Hey everyone, Bridget here at the AAFE Training Center. We are doing some neurotoxin on my patient. So we are going to be treating her frontalis, glabella, and crow's feet in this video. So you'll be able to see a regular neurotoxin for an upper face patient. She has gotten neurotoxin, pretty frequently. I'd say closer to like every 5 to 6 months, but she gets really good results. So I'm treating all the way from those lateral borders to make sure I don't give her any kind of Spock brow. So I'm just making sure to treat wherever I'm seeing that movement. So up into the hairline, all the way laterally, and then no closer than like a finger breadth. She does have pretty hooded eyes, so I definitely want to try to stay a little bit higher for her, just because I don't want to make her feel heavy. We go pretty light in her forehead, just because, like I said, she doesn't want to feel heavy and wants a little bit of movement. She completely understands that, the wrinkles might not completely go away since we're doing such a low dose and because I don't want her to feel super heavy. So when I'm going into my glabella, I'm going to pick up my procerus and then I'm going to treat my medial and lateral corrugators. So when I'm treating my procerus, I'm going full needle depth. On my medial corrugator, I'm going 3/4 my needle depth and then half my needle depth for my lateral corrugator. The lateral corrugator, you just really want to make sure that you're staying within that, end of the muscle, just because if you go outside of it, then you're no longer in the glabella, you are in the frontalis. Or worse, you could drop the lid. So just making sure that your depth is appropriate and that you're not too far lateral there. Crow's feet, very superficial injection. We're just going right where she has a little bit of movement. As you can see, she doesn't have anything crazy, just a little bit of fine lines and wrinkles there. So just really going to smooth those out for her. I'm going to go close to the tail of her brow just to give her a little bit of a brow lift, nothing too crazy. She wants to look pretty natural. Like I said, she knows that the movement's not going to completely go away, which is great. She has those realistic expectations. So now I'm going in with just a little bit of neurotoxin into her brow lift. So like I said, I don't want to raise her up too much just because she kind of wants to keep things looking the same. However, we do want to kind of counteract any heaviness from the frontalis. So it's going to help not only keep her elevated, but to help that frontalis really settle out nicely. Thanks so much for watching.